of University of Idaho and Harvard Law School, is a partner of the Wagner Law Group and is the head of the firm's health and welfare practice. Her practice is in the areas of ERISA and employee benefits with a focus on pension and profit-sharing plans and health and welfare benefits, including COBRA, HIPAA, and the Affordable Care Act. Roberta has spoken frequently on health plan topics since the late 1980s. She is here today to discuss the Affordable Care Act, and in particular, issues of interest to businesses with 50 to 100 employees and what employers need to know to prepare for compliance in 2016. Welcome, Roberta.
Thank you, Ari. In part one, we talked about how you determine whether you're subject to the employer mandate of the Affordable Care Act, and as Ari said, that webinar is posted on our website. Today, we're going to talk about what happens if you determine that you are subject to the employer mandate. The mandate has two parts. It's a penalty tax. The idea is that it's pay or play, and it's okay to pay if you want to. There's a substantial incentive to actually provide the coverage because the penalties are not tax deductible. However, some entities are nonprofit, some employers are nonprofit, and they don't care whether something's tax deductible or not. And for some of them, and some employers who are willing to forego the tax deduction, the penalty actually is a way to just let the exchanges provide their health coverage and not have to worry about it. Most employers, however, the ones we talk to, don't want to pay the penalty and want to, or at least don't want to pay a substantial penalty, and so this program is designed to help employers understand what is involved with the penalty and what they need to do to avoid it. There are two tiers to the penalty. One is called the A penalty. One is called the B penalty, and those tiers are based on the Internal Revenue Code sections in which they're described. The A penalty is the big one. The A penalty is bad. Unless you've intentionally decided you're going to pay rather than play, you don't want the A penalty. Some employers may be willing to risk the B penalty. The penalties may apply if the employer does not offer coverage to substantially all full-time employees. That's the A penalty, and it will apply if, in order to avoid that, you have to offer coverage to 95% of all of your full-time employees, and we'll get into how you determine who's a full-time employee and who is not. And that's the rule starting with January 1st, 2016, or if you have a non-calendar plan year, it starts the beginning of your year. The B penalty is what applies if you do offer coverage to 95% or more of your full-time employees, but some people slip through the cracks. The A penalty is $2,000 per full-time employee minus the first 30. Now, this A penalty can be triggered by even one person getting coverage through an exchange and getting a subsidy for that coverage. The A penalty is multiplied again by all of the full-time employees minus the first 30. So the A penalty is what happens if you fail to offer coverage starting in 2016 to 95% or more of your employees. The percentage is 70% for the period for the 2015 year, but it goes up to 95% for the 2016 year. So the A penalty is what happens if you if you fail to offer coverage to at least 95% of your employees. And again, it only takes one employee to sign up for coverage through the exchange and get a subsidy to trigger that penalty. Now, suppose you do qualify to be exempt from the A penalty because you do offer 95% of your full-time employees coverage. There's still the B penalty to worry about. The B penalty will apply if the coverage you provide, that you offer, is either not affordable or not minimum value for some employees. And the B penalty only applies if the individuals, well, none of the penalties apply if nobody signs up for coverage through the exchange. The B penalty only applies to the number of people who do get subsidies through the exchange. And so the B penalty can apply if for some people it's not affordable, if the coverage is not minimum value, or it can apply to that 5% of people that you may not have offered it to. So the B penalty has a larger amount per person, but it's usually multiplied by a smaller number of people. There is a cap on the B penalty, incidentally, and the cap is the amount you would have paid for the A penalty if you hadn't offered coverage at all. The rule is set up so that an employer that actually offers coverage and avoids the A penalty by providing coverage to 95% or more people, but say the coverage doesn't meet the minimum value test, and say the employer didn't realize that was going to happen. So say the employer offered coverage to 95% or more people, but it wasn't of minimum value, and so a number of employees started getting coverage through the exchange. The B penalty will never be larger. The total amount, the aggregate amount of the B penalty will never be larger than what the A penalty would have been if the A penalty had been what was imposed for failure to offer the 95% of people coverage. The worst possible scenario, though, is for you to bear the cost of offering coverage but still have penalties triggered. So you want to try to avoid that. Okay, the B penalty is triggered if coverage is not affordable for an individual employee. It may be affordable for some and not for others. What's the test for whether the coverage is affordable? The test for the individual to get the subsidy is if the coverage that he or she was offered, cost more than 9.5% of family income. When an individual signs up for coverage, one of the questions that is asked, if the individual signs up for coverage through the exchange, one of the questions that is asked is whether they were offered coverage through the employer. If the answer is yes, then generally the individual is not entitled to get coverage, to get subsidies through the exchange. Anybody can get coverage through the exchange, but you won't get subsidies if your employer offered you coverage. However, if the coverage the employer offered you is either not affordable or not of minimum value, then you can qualify for a subsidy through the exchange if your income is low enough to trigger the subsidy. And I'm not sure the exact dollar amount that triggers a coverage. It depends on your family size, but well into a middle class income can trigger some level of subsidy, and it's the individual signing up for coverage through the exchange and qualifying for a subsidy that triggers the penalty to the employer. Okay, so some employees, it may be more than the coverage offered by the employer might be more than 9.5% of annual household income. how is an employer supposed to plan to make sure that its coverage doesn't trigger a non-affordability threshold so as to allow the employee to get subsidies through the exchange? Well, there's a safe harbor for that. There's actually 3 safe harbors for that. The employer is only required to base calculations on the information that it has available. And the safe harbor that most employers like is the W-2 safe harbor. The rule is that if the premium you're asking the employee to pay is not more than 9.5% of his or her W-2 compensation, then the employer is off the hook for that individual. If that individual manages to get a subsidy through the exchange because the premium is more than 9.5% of family income, which is possible, there might be a business loss or something that reduces the actual taxable income that the individual has to pay. So if the individual is able to get a subsidy based on the premium being more than 9.5% of household income, the employer will not be penalized for that individual so long as the premium the employer charged did not exceed 9.5% of the individual's W-2 compensation. And for many employers, this safe harbor works well for most employees. Of course, it works better if the employee's income is predictable, because you have to decide at the beginning of the coverage period what the premium is that you're going to charge the employee. And if you don't know what their W-2 income is going to be, then it's hard to be sure you're pegging it right at 9.5 or at some specific threshold less than 9.5% of income. But if you know what the employee's income is going to be so that you can peg it correctly, then this this W-2 safe harbor works very well. Sometimes, like with tipped employees, for example, it might be hard to predict what the W-2 wage is going to be. There are 2 other safe harbors that an employer can use. One is based on the rate of pay, and this would be basically the basic compensation, and you would ignore things like tips and bonuses. If an employer charged the employee no more than 9.5% of the rate of pay amount, then that's a lesser amount than the employer could ask if the employer could use the W-2, but still 9.5% of most employees' rate of pay is still a substantial amount, and an employer can charge that. And then even if the employee does qualify for a subsidy through the exchange based on total family income, the employer will not be penalized for that employee. There's a third safe harbor that is based on the federal poverty line, and so that's all. For most employees, that's going to be a lower amount than the W-2 or the rate of pay safe harbor. But if the employer doesn't charge anybody any more than 9.5% of the federal poverty level, then the employer is okay for any of its employees. And that's true. The federal poverty line safe harbor works even if the employee makes less than the federal poverty line, such that 9.5% of W-2 compensation would be a lower amount than the federal poverty line. An employer who pegs the premium charged to the employees at 9.5% of the federal poverty line safe harbor does not need to consult W-2 or rate of pay to determine whether the premium is affordable as far as the employer being penalized. The employer will be safe if it uses any one of these safe harbors. Again, the employer doesn't need to use all of the safe harbors, only one of them, whichever one works out best for the employer. Minimum value. The coverage the coverage the employer offers the employees must be at least minimum value in order to protect against the B penalty. It does not necessarily have to be minimum value in order to protect against the A penalty, but it does to protect against the B penalty. Minimum value is that it must cover at least 60% of typical health costs, which is essentially a bronze level plan that the different metal levels are explained towards the end of the outline. We probably won't get to that in terms of what I speak about, but it's the metal levels are there if you wish to look at them under essential health benefits. The outline will be posted on the website, and the outline from the first webinar should be posted on the website, and if it's not, we will get it posted. Anyway, the minimum value must be at least 60% of the expected total allowed cost of benefits likely to be incurred under the plan. HHS and IRS both have published methods that can be used to determine minimum value. Insurance actuaries can do this. Insurance consultants can often do this. Some people were trying to design coverage to achieve minimum value without covering any hospital expenses or without covering any physician visits. They were able to beef up dental and vision and I don't know what else, and come to a calculation that they covered 60% of charges, but they were nevertheless excluding hospital charges or physician charges or both. The agencies decided this wasn't in the spirit of the minimum value rule, and so there is now a new rule in recent proposed regulations that it won't be minimum value unless it does cover substantial hospital and physician coverage, even if it could reach the 60% threshold without doing that. How will the penalties be assessed? There are reporting requirements which are discussed later in the outline. I'm not sure if we'll have time to get to all of the reporting requirements in detail. If not, perhaps we can do a later program on reporting requirements specifically. But as might be expected with rules like this that involve penalties administered through the tax system, there are things that have to be, various things that have to be reported. You have to tell the IRS who does have coverage and who doesn't have coverage, and you have to tell the individuals whether they have coverage or not and whether it meets minimum value. And so there are these forms that have to be filed. The A and B penalties are not self-assessed by employers. The employer wouldn't necessarily know by itself who has gone to an exchange to get coverage. And for the B penalty, you couldn't calculate it at all without knowing exactly who went to the exchange to get coverage. Even with the A penalty, you wouldn't necessarily be able to know if any of your employees had gone to the exchange to get coverage. So nobody expects the employer to self-assess the A penalty or the B penalty. What is expected is that the employer will make sure these reporting requirements are met. And incidentally, reporting is required for 2015. Employers with 50 or more employees have to report even for 2015, even if they were exempt from coverage. There was a transition rule that exempted employers between 50 and 100 full-time employees from having, and full-time employees and full-time equivalents from providing coverage for the 2015 year. Those employers are going to have to start offering coverage for their 2016 year, but even for the 2015 year, those employers will have to do the reporting. But the idea is that the IRS gets all these reports. It gets reports as to who had coverage and who doesn't, and it matches those with the data that the individuals provide to the exchange when they sign up for coverage. And then the employer decides which employees are matched to which employers, and the IRS will send the employer an inquiry. At the time the employer gets the inquiry, the employer can make various responses depending on the facts. One response may be, I did too provide coverage, and it does too provide minimum value, and it is too affordable based on Safe Harbor 1, Safe Harbor 2, or Safe Harbor 3. So the employer will have an opportunity to explain to the IRS why the coverage is indeed fully adequate and the employer should have no penalty with respect to that individual. Or an employer who does not meet all of those tests may be forced to respond either, no, I didn't offer coverage to that individual, or, well, this is the penalty or this is the premium that we asked, and no, it doesn't meet any of the safe harbors, or no, we offered coverage, but it doesn't meet the minimum value test. And if the employer responds with any of those comments, then that will not be a satisfactory explanation, and the IRS will then assess the penalty after it has the employer's explanation. So there won't be any penalty. The penalty will be assessed by the IRS based on reporting and based on its inquiry to the employer after it determines which employees are matched to that employer. Okay, to whom must coverage be offered to avoid the penalty? In order to determine if you're subject to the penalty, you count both full-time employees and full-time equivalents, and we talked a lot about that in the first webinar, and I'm not going to repeat that here. Once you know, though, whether you're over or under 50 or over or under 100 based on full-time employees and full-time equivalents, you never again need to look at full-time equivalents for that year. You have to, if you're close to the line, you have to do the test every year. But for a given year, you do not have to base coverage on full-time equivalents. You can't. Basically, you only have to offer coverage to human beings, and a full-time equivalent is not a real human being that you could offer coverage to. So if you're subject to the rule based on full-time employees and full-time equivalents, you only have to offer coverage to employees, and you only have to offer it to those who average 30 or more hours of service per week. An hour of service is each hour for which the employee is paid or entitled to payment, so it includes like paid vacation and paid sick leave and paid jury duty leave, that sort of thing. There are several different ways to compute as to whether an individual is a full-time employee or not. The first and the simplest is that if there's somebody you reasonably expect to be a full-time employee when you hire them, then they have to be covered at the end of the plan's waiting period. And as far as the penalty is concerned, they must be covered no later than the first day of the 4th month following the date of hire. Now, it doesn't really work, as will be explained in a minute, it doesn't really work to make them wait 3 months plus the first day of the 4th month, because there's a 90-day cap on the waiting period that you can impose. There's 2 different Affordable Care Act rules that kind of overlap there, and in reality you won't be able to use a waiting period longer than 2 months if you want coverage to all start on the first day of the month. You can use 90 days. You won't be penalized under the mandate for an employee if you offer coverage by the first day of the 4th month following date of hire. But for anybody you hire when you reasonably expect them to be full-time, then you must provide coverage no later than that date. However, there are many employers have people that they don't know how many hours they're going to average during a year. And so part-time, seasonable, and variable rate employees can be tested in one of 2 ways. The simplest way, if it works for you, and if your workforce is predictable in terms of the number of hours they're going to work, is the monthly method. And the way the monthly method works is that if an employee averages 130 more hours of service for a particular month, they're offered coverage for that month. There's a bit of a delay in that the first time they hit the 130 threshold, you're not penalized until they've done that for 3 months. So you can wait and offer them coverage at the first day of the 4th month after they first achieve full-time status. But other than that delay for people who were part-time and have become full-time, you basically have to know at the beginning of the month whether they're going to have coverage for that month. So that's why this monthly method mostly works where the employer's workforce is stable. Like in many law firms, to use an example that I'm familiar with, the attorneys are part-time, are full-time, and they're expected to have well more than 30 hours per week and well more than 130 hours per month, and it's relatively safe to assume that for any given month they're going to have to be offered coverage. And some employers, I've been working with a number of employers who set their coverage threshold at less than 30 hours per week. Some of them like at 20 or 22 or 25. And if your coverage threshold is at less than 30 hours per week and you have a stable workforce, you probably can use the monthly method because you probably will know at the beginning of a month who's going to be full-time and who isn't. And there's no penalty if you cover an individual for a month in which the individual turns out not to work 130 hours. You can always cancel it the following month, but again, by that point, you have to know at the beginning of the month whether you're going to offer coverage or whether not to. And if you're trying to offer it only to people who in fact work 130 more hours of service that month, then that only works if your employees do what you predict them to do. But for many employers, that's the case. They do know at the beginning of a month who's going to reach 130 hours that month or not. So the monthly method is simpler. But there are employers who have employees that they really don't know who's going to average 30 or more hours of service per week. Or most employers have some people that they know are full-time, but there will be some employees that either are scheduled to work less than 30 hours a week, but you have to watch to see if they in fact go over it, or some of them are just plain variable hour employees, and you don't know at any given time whether they're going to average 30 hours per week or not for any given period. So the IRS devised a method of dealing with those that the employer can't predict, and that's called the Lookback Method. and that allows you to test with hindsight and then provide coverage into the future based on what you determine from that hindsight. And so that's a much more user-friendly method for employers who can't accurately predict their workforce from 1 month to the next. The way the look-back method works is that first you choose a measuring period. Basically what you're going to have is you're going to have a measurement period and a stability period. The measurement period is going to be used to determine who qualifies for the coverage, and then those that did qualify for the coverage during the measurement period get offered coverage for the stability period. And as long as they stay employed, they continue to be entitled to be offered the coverage for the entire stability period, even if they drop down to part-time at some point during the stability period. Dropping down to part-time during the stability period will mean that the measurement period they're in at that time will keep them from getting coverage during the next stability period, but once they've earned coverage for a stability period based on a particular measurement period, then they get coverage for the entire stability period. Okay, let's slow that down and parse it through. A measurement period is going to be the period during which you judge whether an individual averages 30 hours a week or not. The employer can pick its measurement period, but that doesn't mean it can use the measurement period for sampling. The measurement period can be anywhere from 3 months to 12 months, but at the end of each measurement period, you start a new measurement period. So you can't like pick your best 3 months and only measure then. And with a 12-month stability period, what you have to do is, if you want to measure people 3 months in 3-month increments, you can, but they have to be back-to-back measurement periods. Most of the employers that I've been working with, if they're using the look-back method, are using a 12-month measurement period. What you do, there are 2 types of measurement periods. There's the standard measurement period for ongoing employees, and you can have this be set to what you want it to be. You might want it to be a calendar year, for example, or you might want it to be a 12-month period that's earlier than your calendar year so that you have enough time after the measurement period ends to determine who is going to have coverage for a stability period. You might want the stability period to be your plan year instead of having the plan year or the calendar year be your measurement period. So you pick your measurement period, which is your standard measurement period for your ongoing employees. Each new hire, however, unless that new hire is expected to work 30 hours per week, though remember that those who are expected when they're hired to work 30 or more hours a week have to be given coverage at the end of the waiting period, and for purposes of the penalty have to be offered coverage no later than the first day of the 4th month following date of hire. But for anybody else, for anybody other than somebody hired to work 30 or more hours a week, you start the initial measuring period on their date of hire. And if it's a 12-month measuring period, you go till 12 months after their date of hire, and you look to see if they had a 30-hour-a-week average during that measurement period. If they did not, then there will be an associated stability period during which they don't get coverage. If they do average 30 or more hours a week during the measurement period, then for the associated stability period, they do get coverage. Now, you are allowed to have an administrative period between the measurement period and the stability period. For example, you might want the measurement period to end November 30th or October 31st in order to give you time to calculate who qualified during the measurement period for the stability period, the stability period might run along with the employer's plan year or the calendar year. The stability period generally cannot be shorter than 6 months. Even if you have a 3-month measurement period, you still have to have a 6-month stability period associated with it. And it also cannot be shorter than the length of the measurement period. So if you have a 9-month measurement period, you can't have a 6-month stability period. You can't have a 12-month measuring period and a 6-month stability period. If you have a 12-month measurement period, you have to have a full 12 months in your stability period, and your stability period can't be shorter than 6 months, even if you have a shorter measuring period. An employee who averages 130 hours during the measurement period must be offered coverage during the associated stability period, and that continues. It ends if they actually terminate employment, but unless they terminate employment, they generally, there are a few situations where people change employers or change categories when it's not quite true, but as a vast general rule, an employee who qualified for coverage during a stability period is going to have coverage during the entire stability period, even if he or she clearly is dropping below the 30 hours per week during that stability period. Okay, I mentioned earlier that there's a 90-day waiting period limitation. Remember that this penalty, the A penalty and the B penalty, is avoided if you offer coverage starting at the beginning of the 4th month after somebody reaches full-time employee status. That's if you're working on the monthly method. However, there's another rule in the Affordable Care Act. There's a number of rules about provisions that plans can and can't have. And one of those is that you can't have a waiting period for your plan that exceeds 90 days. And the penalty for that is not the A penalty or the B penalty. The 90-day waiting period limitation has nothing to do with that penalty. The penalty for violating the 90-day waiting period limitation is $100 per day per affected employee. That also can be a really big penalty, and you don't want to incur it. So you want to make sure that your waiting period does not exceed 90 days. And it can be complicated as to how the 90 days overlaps the employer mandate calculations. But basically, if you have a waiting period of 60 days instead of 90 days, then you can wait till the first day of the month after the end of the 60 days, and that'll be fully within the rules. But if you make people wait 90 days, then they have to go in on the 91st day. And incidentally, there's no exception for it falling on Saturday, Sunday, or a holiday, and they get in on the next business day. It's the 91st day, no matter what. And if you need it to be a business day, then you can make it the earlier business day. But it's very important to make sure that in planning out your liability or exemption from the A penalty and the B penalty, you want to make sure you don't accidentally violate this 90-day waiting period limitation. The 90-day waiting period limitation applies to grandfathered and non-grandfathered plans. There can be eligibility criteria in terms of categories of covered employees. For example, you could exclude your hourly employees as long as you're still offering coverage to 95% or more. You could exclude people who don't accumulate a certain number of hours, such as 1,200 hours of service. you can have these category rules as long as they're not a subterfuge to avoid the general rules, such as the 90-day waiting period limitation. So even the employer mandate rules, the A penalty and the B penalty rules, those don't really require that an individual be offered coverage. I mean, nobody goes to jail for failing to cover anybody. There's a prescribed consequence for failing to cover certain people if certain people get coverage through the exchange, but that doesn't mean you can't have excluded categories. It just means you're vulnerable to probably the B penalty if you don't cover those and the individuals end up going to the exchange and getting subsidies. For example, you may have a category of employees that you're pretty sure all get coverage through their spouses, and you really think that if you exclude them from your plan, they'll still have coverage, so they won't go to the exchange, so you won't have penalties for them. And that may work fine. You will be at risk for one or more of them getting coverage through the exchange and getting a subsidy. And so you may occasionally incur a $3,000 per individual penalty. And for some employers, that's an acceptable risk, and for some, it isn't. There is room in the rules for an orientation period that does not exceed a month. I haven't encountered anybody who actually does that. Rehired employees. If they're rehired within 13 weeks, they just go back on the clock as though they had never left, and their hours that they would have worked during the interim weren't worked, so those hours missed will count against them in the calculation of the number of hours for the measurement period. But if during that measurement period they are they do average over 30 hours per week, then they will go in for the next stability period. Employees hired after a 13-week absence, they may be treated as new employees. Okay, the materials in the outline are here in the outline for how to determine if you're subject to the mandate. The reporting requirement is at page 20 of the outline. We've pretty much reached our 45 minutes. And let me say some things about the reporting requirements. This is based on page 21 of the outline. Reporting is done separately, and the computations for the penalty are done separately for each member of the control group. The control group is tested as a whole to determine whether the control group members are subject to the employer mandate. But once it's determined that a particular control group is subject to the mandate, each member of the control group computes its penalty separately, and each does its reporting separately. So, and it's okay to have one control group member, such as the parent, do the reporting for everybody, but the reporting is done separately, and the 30-employee exclusion from the A penalty calculation then gets prorated to the different control group members based on their full-time employees. It's a good idea to document everything you're doing. You want to document your calculations as to whether you're subject to the penalty, and you want to document that you're offering coverage to the people you're offering it to. You want to document things like how you're determining affordability and how you're determining minimum value, so that you will be able to respond to the IRS and be able to respond to the Department of Labor. The Department of Labor might follow up and make sure that you're doing things in accordance with your plan requirements. I'm happy to take questions if there are questions. Okay, here's a question. How do any of the reporting rules apply on the accepted benefit arrangement on any discrimination issues? Oh, wait a minute. Well, accepted benefits, an accepted benefit is, there are several ways to have something be an accepted benefit. A standalone dental and vision is an accepted benefit. Certain types of coverage, such as disease-only plans or indemnity plans, are accepted benefits. Those won't constitute those won't constitute acceptable coverage if they are accepted benefit. I'm not really sure how the accepted benefits are reported. That's a good question. I'll check that out and maybe figure out a way to report it on the website. Any other questions? Okay, I guess there are no other questions. Thank you for your attention. We appreciate your signing in. We'll try to do some more webinars in the future.